Looks like we have quorum. Yeah? Should we get started? Or do you want to wait yet? It looks like there are other people in the waiting room, so. Okay. Welcome everyone to the August meeting of the Finance and Revenue Committee of the Universal Health Plan Governing Board. Happy August. We'll start with roll call.
Good morning, everyone. Cheryl Ramirez.
Here.
Chunwei Chi. Don't see him in the list. Mary Lou Heinrich.
Here.
Thank you. Richard Gibson.
Here.
Thank you. Jeff Goodman.
Here.
Thank you. John Santa.
Here.
Thank you. Bethany Stairs. Don't see Bethany. Charlie Swanson.
Here.
Thank you. Yeah, we have quorum.
Thanks, Isabel. So we'll just briefly review the agenda. Mimi's going to go over some follow-up from previous meetings for a few minutes. She'll give us an update on the governing board and other committees. And then we're just really going to launch into the core of our work. We're going to talk about this kind of cool calculator that Will and Charlie in particular worked on, and then look at our revenue options. So we're going to spend really most of the time on that today with a break in between. And then we'll go into meeting reflections, next meeting topics. Do we have public comment today? Forgot to ask that.
We have one person signed up for public comment.
Public comment. So that's it. And then I'll turn it over to Mimi.
Great. Good morning, everyone. All right, so just some follow-up from the prior meeting, last month's meeting. One of the things we talked about is recruiting a new committee member for the Finance and Revenue. And so the staff, we've created a process for that because that heretofore has not been created. There was the original member. So that process is going to go before the board first, and then once that is approved at this upcoming board meeting, then we'll work on getting a new committee member. It shouldn't take very long. Speaking of things that won't take very long anymore, very excited that our consultant group, Milliman, we have a kickoff meeting with them at 1 o'clock today. So I think that's going to be something that will be a big support to the work of this committee and, of course, the work of the other committees as well. Revenue model tool, as you know, our consultant group Echo Northwest created an updated version of the revenue tool that was created by Charlie Swanson. Thank you so much. And so that was sent out to committee members, and it's also posted on the website so people could sort of create 2 to 3 options of different types of revenue plans, and that's all going to be shared today. Last meeting, we did talk about reserve and surplus requirements. That's not as additional agenda item on this month. However, I did send out a reference sheet just to have some additional context for and additional information regarding that topic, but it will be coming back in later meetings. And then just lastly, people had also asked about the single payer health system in Taiwan. So the excellent article by Dr. Chi, I included that in the meeting materials as well. So we can go on to the next slide. Great to round up what's happening at the board level and also with the other committees. So at our last board meeting, the board continues to revise the mission statement. Now, the work that has been done on that is going to the Community Engagement and Communications Committee. The board also discussed function of regional entities within the Universal Health Plan, and that's going to be another board topic coming up, and also about where what type of entities and where risk will be borne within the Universal Health Plan. However, the August meeting, the main focus, just as this meeting's focus is, will be on revenue options, and Echo Northwest is actually going to present at that board meeting. So I encourage all of you who are on this committee, we would absolutely appreciate it if you're able to join that board meeting. Next, as I said, the Community Engagement and Communications Committee, they're completing a style guide for that will be useful for all of the Universal Health Plan documents that are created. Patty Wentz is on board and doing incredible work with the committee chairs and the committee members on the whole communications work plan and a strategic messaging guide. So that's exciting. And then we're working on setting up targeted community engagement meetings now that as the actual plan is getting fleshed out a little bit more, we're going to go out to specific groups within the community to get their feedback. Next, plan design and expenditure committee, really still working on the provider reimbursement aspect of plan design and expenditure. At this upcoming meeting, the focus is going to be on primary care reimbursement and then moving on to additional sort of large chunks of the reimbursement, so behavioral health and inpatient payment strategies. Also working on something that is important, which is the standardization and the simplification of the quality metrics that are used within healthcare, and which can be, as people who've been around healthcare know, a tremendous can be a tremendous help, and it's very important, but it can also be an exceptional administrative burden. So it's going to be a big part of that work. And lastly, but not least, operations, continuing to work on startup costs, which will also include those reserve and surplus requirements. Doing a lot of work with administrative structure, and then starting to kick off with IT infrastructure. And I see, Jeff, you have your hand raised.
Yes, thank you. I watched the recent operations meeting and the recent communications meeting, and I think that there is a need for some better coordination between at least those two committees and what we're doing. Neither of those, the operations committee, as an example, wasn't aware that we're talking PEB plus in terms of coverage. That seems to be something they should be aware of, that that's the route that we're going down at this point. Another example on the communications committee is another one that we're not aware that we're talking PEB plus. They don't know that we're talking about a brand new plan as opposed to just trying to cover the remaining 5%, which is where they spent some time talking about. So the total dollars on the operations side, where we're talking a range, at least at this point, the incremental tax dollars of anywhere from $14 to $20 billion a year, the operations committee wasn't aware of that. So I offer this just simply as a suggestion that I think there needs to be some better communication between what's going on with the four committees. What you presented today was great, but what was not presented are some of the points I brought up, and I think they're important for those committees to be able to do their work.
Thank you, Jeff. I apologize. My Wi-Fi went out during a part of that, but I did catch, I think, what was the most important part, which was definitely making sure that there's communication between the committees. And so I'm going to circle back and hear from, I will catch up with staff to get the entirety of what the comment, to make sure that we get all of that information communicated to the operations committee. So I appreciate your comment.
Thank you.
Sorry about that. It's supposed to be at the good Wi-Fi place today. Next, one of the things for a follow-up that we had discussed in this committee and also at the board level was, of course, there's this question of, if there is a trust fund for the universal health plan, would those funds be subject to the Oregon kicker rule? And so what I'd like to say, so Lee Hastings, our senior policy advisor, is going to give some comments. What I would like to point out, just as a little bit of a preamble before this, is that the information that is being shared, this is essentially, I don't want to say hypothetical, but of course, because there is no plan that as of yet has been created, this would not be something that would be considered an expert legal opinion based on something that's created. So I'm just trying to set the stage so people understand we are talking, if more in a theoretical sense, than something that is completely set in stone. And of course, as the as the plan is created and has more detail, we'll be able to provide a more detailed update from our Department of Justice colleagues. So sorry for that preamble, but I just wanted to make it clear. And thank you, Lee. Go ahead.
All right, thanks for that bit of level setting there. So yes, this group previously had some questions regarding what's known as the Oregon kicker. And just to kind of level set, make sure we all understand what we're talking about, that first bubble shows the quote directly from the Constitution, but in case you don't want to go through that legalese, the basics of it is that excess revenue in the general fund that is remaining after a biennium gets returned to taxpayers, something known as the kicker. The second point here, this is just for context again, noting part of the charge of the Universal Health Plan Governance Board in examining what it would take to create a universal board was asked to look at the possibility of being funded through its own trust plan that would retain revenue. And so the question this committee had was, how do these two pieces interact with each other? Next slide, please. All right, so as noted, we did have some discussions with our DOJ partners, and from reading those two things and from just referencing other parts of the statute, they were able to point out that there are, in fact, other trust funds that exist within Oregon law where their revenue is specifically established as not being part of the general fund and therefore not subject to that kicker that is in the Oregon Constitution. And here are just some of those examples. There's, I think, 8 or 9 here. So our conclusion to this committee being, of course, as noted, there is no Universal Health Plan Trust Fund at this point in time, but the legislature has demonstrated in the past an ability to create trust funds that are not subject to the kicker. So the possibility certainly exists that they could create a Universal Health Plan Trust Fund that would also not be subject to the kicker and could therefore retain revenues. So happy to take any questions. I do see there's a raised hand.
Go ahead, Charlie.
So I think that's not quite the right way to ask the question in my mind. The question is not so much, can you create a trust fund that's not part of the general fund? And the answer is clearly yes. The question is, can you put money directly from taxes based on income into a trust fund that is not subject to the kicker? Basically, so that's not the general fund. I mean, for example, the Common School Fund exists, but legislators are not able to say, oh, we're going to put all this money coming from income tax into the Common School Fund. Most of the money that goes into K-12 education is income tax money, and it is subject to the kicker. And if they could just say, oh, no, it's not income tax money, we're putting it into the Common School Fund. It's not general fund money, we're putting in the Common School Fund. That could solve a whole lot of problems. And the fact that I haven't done it would suggest to me that there's something more going on here. And that's what we really need to explore is, can you put money that's raised from an income tax into something that is not subject to the kicker? So it's a very specific question.
Yeah, and just to kind of expand on that really quickly, and I'm happy to do some further research into it, but from our conversations with the DOJ and looking at some of these other funds, I would say, just tentatively, yes. What you can't do is just take that income tax and decide that it's going to a certain trust fund. But if by statute a certain percentage or portion of an income tax is already designated for a trust fund, then that essentially, it never touches the general fund. So less related to whether it's an income tax or payroll tax, but more whether the statute directs it in a certain place. That's my preliminary understanding, but happy to look into that more.
John.
Yeah, thanks for this. Is the Industrial Accident Fund basically safe, and where safe's reserves and all are?
I don't believe I think this is a different fund than SAFE. SAFE has its own statutory kind of section and fund setup. So it's a different ORS, I believe.
Huh. Well, it might be nice to know how they did it. Because I think you can argue there's some similarities between SAFE and what they're doing, and maybe clarify what the Industrial Accident Fund does versus as opposed to workers' compensation via SAFE. Thanks. That's interesting.
I can absolutely do some more digging into that. Thank you.
Any other questions or comments before we move on? John?
Yeah, is the Milliman meeting at 1 a public meeting, and is it going to be recorded?
It is not a public meeting. However, certainly the content of the meeting will be shared.
So so that sounds like no to both, because the content will be a document, or will it be a recording of the meeting?
The content of the meeting will be shared as a document.
Okay.
Mimi, do you have any other updates?
I do not. Thank you.
Okay, so we'll move forward with potential federal impacts and calculator updates. I think well, I don't know who's on, so leave it up to Echo Northwest to decide. Oh, Mary Lou has her hand raised. Go ahead.
That was really a follow-up to John's question and Mimi's response. So who will be attending that meeting with Milliman?
Me.
You, Cheryl?
Mhm.
Okay.
Yes,
That is-
and I
I
believe.
don't know who else, but I know.
Well, staff, I would say staff and the board chairs.
Okay.
But I will just state, this is a 1-hour kickoff meeting, really just to sort of set the agenda. There's not actual really work that's going to be done during the meeting. It will just be almost like timeline creation, and all of that will be shared. Certainly we will have Milliman will come and be present and present at this meeting and at the board level as well.
Thank you.
John?
Yeah, well, that's good to hear that you're going to be there, Cheryl. Again, I would just emphasize one of the things we didn't do a good job of on the task force was make it clear that the Optimus tools themselves, the Optimus programs, kind of like Charlie's work in the calculator, would be owned by the task force going forward. So my impression is that is the case with the Milliman's work, and basically whatever models they develop and use will be the property of the Universal Health Plan Governance Board. And
That's correct.
Yeah, I just want to emphasize, as you can see, in terms of Charlie's work, how important those tools can be, and the folks who follow us, their work will be so much easier if those are available. Thanks.
Certainly agree
Absolutely.
with
Thank you,
that.
John.
Yeah. Any other thoughts, questions, comments? Okay, we'll hand it over to Echo Northwest.
All right. Thank you very
Thanks,
much.
Paul.
Yeah, of course. I'm going to try to share my screen now. Share. That's okay. Can everybody see that?
Yes.
Good morning, everybody. This was a sort of hodgepodge that is meant to discuss sort of outstanding issues, and there are sort of two. Andrew, there are two broad types of issues that I've been asked to discuss. Um, the first one is the implications to give some sort of sense. Obviously, the huge elephant in the room here is that we're working in the context. I don't know if it's fair to say that the ground is shifting anymore. Maybe it's settled, but it's uncertain territory. And so we're, the assumption certainly that optimists would have made, and Rand and everybody that's come before us have been shifted. And so with respect to federal healthcare programs and in particular the amount of money that's transferable to a prospective universal healthcare system needs to be revisited. And again, as John mentioned, we're thinking in terms of range. I personally don't see, any other possibility that seems to be the most productive way forward. So, in keeping with this idea that, we're going to develop a plan that is capable of contemplating contingencies, maybe the error band or the realm of possible scenarios that we'll have to consider has expanded. But I wanted to try at least to, precipitate a discussion to signal that, this is something that we're going to have to keep on our radar, and also, I suppose, to indicate that, probably there's not much more we can do beyond our strategy of thinking in terms of ranges, right? Certainly, our ability to estimate the precise value of the funding gap hasn't increased. In fact, it's probably decreased. So I want to give some sense about and I would love people to jump in throughout this presentation, but particularly in this realm, because you all are much more expert than I am. So what I'd like to do is to discuss the implications of the federal healthcare reform for the funding gap. And then I'd like to make some general remarks about the tax revenue calculator, which I think any mistakes that are in the tax revenue calculator are not Charlie's. They're undoubtedly mine, but I'm hoping that by December or whenever the deadline is when we actually need to formally submit something to the board, this tax calculator will be an excellent tool that will help both us arrive at our proposals and also be a tool for both for the board going forward and for interested parties. Yeah, John Santo.
I hope it's okay. You are open to.
I am. Yeah, I prefer that, frankly.
Yeah, I mean, on that one. So when you say 3.8 billion, is that both state and federal contributions, or just one or the other? Can you always clarify that?
Yes, I'll show you precisely what I mean, and please feel free to tell me what I may have done wrong or anything. So I have another slide that's going to show you the math where I arrived at that.
Okay.
And I hope that you'll jump in at that point.
Okay, great. And then the second, I missed the last meeting, but there was a discussion about a Medicare. There are significant Medicare changes, and so are you going to discuss those in an upcoming slide?
Oh, yeah, you're going to make me jump ahead. I'm going to discuss one of them, and I hope that what I like to do is take a lot of notes here. So if there are more that you're aware of, or maybe the way to state this is I'm going to suggest that this is something that we need to discuss, and I'm also going to suggest a forum for which we can do that. In particular, we're going to circulate a jam board. I worked for the ACLU once, and that's what they call it. The kids call it, right? It's just a place where we can collate everybody's suggestions and respond to them. And so if there are other things about Medicare or anything else that you think are relevant to keep on the back burner, then I think that would be a good place to do it. But I'll get to that if you don't mind, John, and then you can.
Okay. All right. Great. Sorry.
Oh, not at all. No, Charlie?
I think my comments are related more to the details that we'll get to later, so I'll hold on.
Okay, yeah. Again, same ask. Please harass me if I don't get to what you'd like. So, yeah, I am not. I'm not the expert that you all are on healthcare, and certainly the most recent federal budget is not something that particularly this aspect that I understand in great detail. So I'm asking for help. I just did some napkin math to throw something out there that hopefully we can discuss. So we'll go through that math momentarily. I will make a couple recommendations throughout just to, I think, precipitate conversation. So again, I'd like us to, I'd encourage us to think in terms of the final product and sort of backward inducting from a December deadline and what it is that we'd like to include in the final report. And in that vein, Cheryl made an excellent comment that, in hindsight seems obvious. And in particular, again, I'll be getting to this, but I'd like to point out that in terms of a final product and in terms of, fulfilling our mandate about thinking through the implication and the incidence of a proposed tax collection plan, we need to think about, the tax plan as it currently exists in order to see how it changes, of course. And I think that, prior to doing this exercise, which is perhaps a very dry run, but certainly before we pass something onto the board, I think I personally think, and I would suggest I would present this to the committee as something to consider, that maybe we have a table in the report or something that shows status quo tax collections. I tried this before in a very sort of superficial way. I've revised that table, and I'd like to suggest and solicit comments for future revisions. I'd like to discuss a sales tax corrigendum. Hat tip to Richard and again, of course, Charlie for pointing out that the retail sales base that I was using probably understated retail sales in Oregon by less than half, probably 3/8, I think is a reasonable guess. And then I'd like to have, the discussion I alluded to earlier. We have a sort of general planning about things that I can help, that Echo can help to get us well positioned to deliver a good product in December. Okay, here's my math. Feel free to jump all over it. Okay. I think based on my superficial reading of the the implications of the big beautiful bill for Oregon, I think that probably there will be a 22% drop in available federal funds. Where I'm getting this from is that there's sort of two factors that I'm aware of, probably lots of other ones, but to at least do a first order approximation, maybe the most important are a reduction in coverage, right? So, and that will be led, I think, largely by more onerous work requirements that reduce the participation rates, and then a step down in the provider tax, which leads to presumptive. So in total, the combination of those two things, I think, leads to a approximately $4 billion decrease in the revenue that's available for the Universal Healthcare Program. Those are, I'm denominating everything here in $26, 2026. The exercise we did is a exercise in a counterfactual 2022 environment. I should preface it with that. Should also preface it with, in terms of the provider tax, I was, perhaps this is what Charlie is going to point out. I'm not sure how that's being counted in the Optimus and Charlie calculation. So maybe I'm double counting here, and I shouldn't be removing that. But Charlie, would you like to go now, or do you want me to?
Yeah, I would like to go now. I would say the provider tax
Yep.
is there to match federal Medicaid money.
Yep.
And if we have less money coming from the federal government anyway, then we don't need to match it so much.
Yeah.
And the other piece is that's in the current system. In our new system, it's, we aren't going to there's no need for provider tax. It's just sort of a circular money thing. So I really think that counting that provider tax as a loss is inappropriate at this point. And it also, the other thing that is going to matter is what's going to be Oregon's response to the drop in federal money. And again, if you look at potentially 3.2 billion loss, Oregon's share of that is on the order of 30% or something.
Mm-hmm.
And so that's already 900 million, which is more than 900 million that Oregon does not have to provide because we aren't having so many, and so the provider tax is not there. So I really think that shouldn't be considered a loss.
Yes, fantastic. That's what this has really been troubling me. So I appreciate that very much. Let's, in the interest of being constructive, let's ignore this. Okay. I wish I was a little bit better at this. I would strike this through. You know what? I'm just going to delete. What I want to focus then is perhaps the reduction in available funds that are due from 200K disenrollment. This is an estimate that comes ultimately from the Kaiser Foundation. I found it in Oregon Capital Chronicle. It looks like a legitimate outlet. So the claim is this. Feel free to dispute any aspect of this, but the claim there is that in 2026, 200,000 people out of 1.4 million, the 1.4 million comes from the Optimus estimate, would be disenrolled, actually, would be disenrolled over time. That's really what it is. But for the sake of argument, let's say 200,000 people would be disenrolled due to work requirements or other disincentives. 200,000 is 22% of 1.4 million. So if you follow that logic, the total available dollars from Medicaid should be reduced by 22%. So that's 3.2 billion out of 14.6 billion that would presumably be added to the funding gap. Yes, Charlie?
Yeah, and so another argument could be made that those who would be disenrolled are presumably those who are supposed to work, and those who are supposed to work are among the people who probably in general need less health care among the Medicaid population than the rest of the Medicaid population. So my expectation would be that those would be people who tend to get less health care spent, have lower healthcare expenditures compared to the rest of the Medicaid population. So I think that that's probably
an overstatement again.
Quite a bit of an overestimate, but it's hard to. I have no idea how you'd estimate what it really should be, but I would say that is absolutely is a very high estimate compared to what it probably is.
Yes, point well taken. So just to echo it back to make sure that I understand it. So these people who are hypothetically going to be disenrolled are probably healthier on average to the extent that they're able-bodied and expected to work under the new plan. Therefore, the per capita Medicaid expenditures among that group would be lower. And so it is a mistake to multiply 22% times the total because the total includes people who are less healthy. So this overstates the
yeah, and then another sort of counter argument to that is these are adults who probably need more health care than children, which is a large portion of those on Medicaid. So it's really hard for me to know how to estimate that. So the estimate could be right, but I would say it's a high estimate.
I just wanted thank you very much. This is exactly the type of thing one would want to throw out if it wasn't napkin math, right? I just wanted to put something on the table that we could at least think about. Yeah, great points, Charlie. And Anya?
Yeah, thank you. Sorry, it was hard to figure out how to raise my hand. So I just started waving and now it'll probably raise it again. So I can say as a former Medicaid director who was actually Medicaid director when the ACA kicked in, you basically have 4 buckets, and this is an oversimplification, but you have 4 buckets of people who are eligible for Medicaid. You had 5, I should say. Historically, you had women with children or women who are pregnant. You had children. You had people with disabilities. And then with the ACA, we swept in single adults without children. The major impact of that in a Medicaid program, at least the one that I was running at the time, was that a whole lot of single males with substance use disorder became eligible for Medicaid. So I would not assume that these people who are eligible to work are necessarily low cost. They are lower cost than, say, the population with disabilities who are generally dually eligible for Medicaid and Medicare. But the cheapest Medicaid enrollees are children. The next is pregnant women, because you can kind of quantify, like that's an event around which you can put a fence. But some of the single childless adults who came on as a result of the ACA expansion, who are the ones who are going to be most impacted by the new policy, actually have some fairly expensive needs, and had, in addition to the substance use kind of interaction, just had like unmet healthcare needs for years. The other thing is on the provider tax. So I think the significant thing there, Charlie, is the lost federal revenue. Yes, at the state level, it's kind of a shell game, but it allows the state to bring in federal revenue. So to the extent that it's limited, you're limiting or reducing potentially the amount of federal revenue that you're bringing into the state's Medicaid program.
Well put. Good point. Chair?
I just wanted to echo what Anya said. I agree with everything you just said. And I think too, I read this somewhere recently, it may have even been KFF or something, that 90% of people on Medicaid or something like that already work. So the people they're trying to find here to require them to work, I'm not sure if they're going to find that many people who actually are able to work, who aren't already working. So I don't know how to quantify that comment.
Yeah, I'm also a bit puzzled because I saw the same statistic. In fact, I think you pointed me to the article that said that 90% of the folks already work. But I'm finding that hard to reconcile with this number that came from the same article, that 200,000 people would be kicked off. So I'm a bit confused. But yeah, Charlie?
I think it's a classic Medicaid administrative maneuver. You create a paperwork requirement and people fall off.
Yep.
Yeah. So even if they're employed, they may not
They
may not do the paperwork, they may not submit the paperwork, they may not get their mail because they change addresses.
Yeah.
Generally in this population a lot. So it's the administrative barrier, not the lack of work.
Every 6 months, I think, right? Every 6 months.
Yeah, having to re-up every 6 months, that's going to be a problem too. Yeah.
Charlie?
Yeah. So I think that both what Anya and Cheryl said is correct, that it's the administrative barrier that's going to shut a lot of people out. And that question is, how much will states be able to help people overcome that administrative barrier? And that might be different in different states. And so, so another number that I have seen and looked at is estimates of what the actual loss in Medicaid funding will be overall. And I think this was from the CBO, but I'd have to go back and look. And it was more on the order of somewhere around 10% rather than 22%. And this is nationally. And so and Oregon might have a little bit higher loss than others. So I think again that 22% is probably an overestimate.
Thank you very much.
It may be, although the estimates skew towards the more generous you have been as a state in the past, the more you stand to lose.
Yeah.
So I would think Oregon would be at the high end.
Yeah, we'd be among the highest. So that's also would suggest it might be well over 10%. So another comment is, if you look at what happened when the ACA came into play, those states that expanded Medicaid the most had their per capita expenditures go down the most, because they were in fact enrolling people who on average required less. I mean, it wasn't a huge amount that they went down, but again, the more expansion you had, the more your per Medicaid enrollee expenditures went down. And so the ACA did enroll cheaper people, although not as much cheaper as you might imagine if they were all healthy, because of the things that Anya said. But it was in general cheaper than the other groups.
Yeah, that's an interesting data point. Yeah, a fascinating question. We could definitely go down this hole. John?
Yeah, I just can't resist pointing out, I think, what this group knows, but here we see rationing of healthcare by increasing administrative services slash obstacles.
Classic.
That's what it's all about. I mean, realize we've already talked about a lot of other administrative services that are in there now, that are doing that now. And, I was listening to a discussion, this has already happened in Michigan. It's happened in Arkansas. They took two very different administrative approaches. In Arkansas, I think they made it really difficult or just cut off people really quickly. In Michigan, they worked much harder. And they had, significant or less people cut off, though I think they still had some. So this has been done out there, but this is the classic game that folks are playing. Hire administrators to basically figure out how to ration people. It will be interesting if there is some folks who can frame that to the public and effectively explain, what's going on here.
I mean, well, I don't want to get too bogged down, but people have written very eloquently about precisely that point, right? Yeah, I mean, I'm almost inclined to say cynically that, if those voices couldn't do it when that was more ubiquitous, particularly in the South and things like that. Yeah. I'm going to try and stay positive here. This is an area where I'm going to perhaps cold call Mimi to some extent, because I understand this even less than I understood that before. My understanding, garnered largely from perusing KFF website, very nice source, obviously. There was an AHEAD program, which I understand to be something of a pilot program to that was, obviously it's pre-Trump, to allow for more individual state flexibility to leverage federal funding in order to extend healthcare. My understanding is that this is an 11-year program. It started last year. Take-up rates, I think, have been extremely low. I believe Maryland, Vermont, and Pennsylvania have been the most active in exploring this as a potential option. Somewhat akin, I guess, to what Charlie is saying. This is not currently an option that Oregon has been availing itself of, and maybe it didn't have plans to do that. But I guess the point I'm trying to make here with this slide, and John can perhaps tell me other Medicare changes. The point I'm trying to make here is that there was a potential window of opportunity to creatively leverage federal funds for a universal healthcare program, and the claim that I'm suggesting perhaps is that opportunity has been shut. Mary, I saw your hand up.
Well, my thing was, I'm not sure that it's that relevant, but I do know that Oregon has, always gone for trying to figure out ways to, burrow under the fence, get around the fence, climb over the fence, do a variety of things. And so I think that I trust that our state folks are thinking very hard right now on how to lessen the impact of this and to, so sometimes I feel like we've got to show that, yes, there's going to be huge impact and it's terrible and all of that, while behind the scenes, we're working to not really make it so difficult and to figure out every possible wiggle room that we might have. So anyway, it's very hard when people ask me this question of what's the impact, I kind of throw my hands up and say, this 200,000, that's an estimate from where, all those pieces. So I guess I'm saying, yes, there will be some reduction that I think that our Oregon colleagues will be working as hard as they can to make it as small as possible. But it definitely is there, and it makes things difficult right now because people say, well, what will happen now because of this? And I hear your struggle, Will, and thank you for taking a stab.
Yeah, I just wanted to, I think what I just wanted here is to acknowledge all these things really, so that they were on the table because they feel like an elephant in the room, right? But I'm kind of inclined to I don't know if this is, I'll put Charlie, I'll give Charlie's impromptu on it because it's a credible one. But I think maybe a way to circumvent this now or to bracket it or something is to say something like, okay, CBO said it was 10%. This other math said it was 22%. Maybe we just think in terms of ranges, right? There's a lot of really interesting questions here about beneficiary levels and usage levels and who would get kicked off and what the time rate, the timeline for that would be. But maybe for our purposes, we just think in terms of broad ranges about the percentage reduction in Medicaid expenditure.
Will, can I add about AHEAD? AHEAD
Yeah.
has only had 2 or 3 rounds of opportunities to apply. Oregon and Washington, neither of them applied during those rounds of opportunity. The last ones being during the Biden administration. So it isn't that there hasn't been a lot of take up to date, but that was back then. Hawaii is newly rolling out their AHEAD, as well as those states of Maryland, Vermont, and PA.
Got it.
So and of the Centers for Medicare and Medicaid Innovation models, it's one of the models that didn't get cut. And so there is still progressing these models at this point. And as per our paper we did on waivers, this was one of the opportunities to be able to, get a waiver to use Medicare dollars. So the question really is when does the Trump administration, will they open up another round of applications and then who applies? So
That
it
is-
isn't the program, many of the about 3 or 4 other CMMI models were cut or ended early, but this one did not.
This is fantastic. I hate to use up everybody else's time, but I can't resist here. So the optimist solution was that by 2026 there would be just shy of $10 billion in Medicare Advantage. I think they were just assuming basically that all the Medicare dollars would get a waiver. In your claim in your paper is that in order to actually make that a reality, Oregon would have to creatively would have to be, apply.
They would have to apply. There would have to be an opportunity to apply. They would have to apply. And then they would have to have a multi-payer collaborative.
Yes.
In the current world.
Medicaid.
And they need to create global hospital budgets and then some global approach to paying for outpatient care. So it's, in a UHP world ours might look different than that, but.
Yeah, that's wonderful. Yeah. I'll just.
It's not a guarantee that the money would come through AHEAD. I think you really have to assume not necessarily. So I think that you just have to look at the Medicare dollars as they are today in your modeling, but.
Would you, I don't want to get too bogged down, but would you say then that that perhaps the optimist estimate is problematic to the extent that it assumes that we'll get all the Medicare? I mean,
Well, it does assume that, and as some states have, such as Washington, have decided not thinking that it's going to be too hard to get a waiver for Medicare dollars, have just decided to go to try to get everything else unified, and then maybe help provide some supplemental dollars to people to pay for their Medicare premiums.
Oh,
so
dear.
some states
I
have
see.
done that in their universal health approach. Whether we can ever get this or not we just won't know until we start to have those conversations with the feds. You can't really read yet whether that's something the Trump administration would do or who the next presidential administration, what their view on that would be.
Yeah. Thank you, Jeannie. That's extremely helpful. I wanted to, so there's been a suggestion by a former board member about this, and in fact, his particular ask was to fill it out for every possible cell in here. I thought it was a useful heuristic, if nothing else, when we created it, and so I just kind of followed that up. And again, so the math is going to be problematic for multiple reasons that we've already discussed. But I wanted to point out that if you buy my overly conservative 22% reduction, the implication of that is that, since I've now adjusted it, that we'd be looking at in FY26, not FY22, which is what the exercise was about, $25.2 billion gap that needs to be filled. Again, lots of provisos here, just some napkin math. John?
Yeah, Will, just going back to my earlier comment, my impression is there are other significant Medicare changes than the AHEAD program. And I don't know if you're going to mention those, but
I'm not. Yep.
Yeah, just for the committee, my understanding is, not surprisingly, access to Medicare for non-citizens will be eliminated. There are non-citizens who pay into Medicare, sometimes for their whole career, green card holders, other people who are eligible for Medicare. My sense, and Janine or Anya may know better, those people are in trouble. As may, I think there's been a buy-in to Medicare for non-citizens, primarily used by wealthy non-citizens whose children, oftentimes in IT, their parents come and they're able to buy into Medicare. I think that would disappear. I believe that the bill also gets rid of the subsidies for Part B Medicare. I think this is called Quimby's and all, and I think it either gets rid of those or decreases them significantly. These are trying to help people not on Medicaid, low income on Medicare, who have trouble paying for their Part B premiums. And finally, the thing that I couldn't quite understand that I read is that at least some folks think that the act will trigger a law passed in 2010 requiring some kind of balance. And that could result 4 years from now in the need to raise hundreds of billions of dollars to, if you will, balance Medicare. So the point is, there's other things that would have an implication for us in terms of how we've thought about universal healthcare, how the task force thought about it.
Thank you. I'll follow up on those. Jeff? I'm sorry I called you John earlier, Jeff.
As long as I get called for dinner, I'm happy.
Sounds like my mom would say.
Again, thank you for the material you've presented here. It's very helpful. Do you see on a projection going forward, and whether or not the number is a range of $1.5 billion to $2.5 billion? I'll say that just for discussion purposes. Do you see that number being a one-time hit and then sort of leveling off and going down, or do you see that number continuing to increase in the future years?
I think other people are probably better prepared to answer that question. But since I have the floor, I'm going to take the liberty. I think it would probably increase, right? I mean, the assumption here is based on yes, I think it would increase, right? To the extent that Oregon population is growing, and already kind of questionable, right? The proportion of people who are going to get disenrolled will stay constant. Will reach some sort of steady state, but their number will increase, and therefore the the product of the number of people disenrolled times the benefits that they would receive, that number would increase. And so, the total number, the gap would increase over time, is my intuition.
And just as a follow-on to that, do you then see that the delta between whatever the revenue plan that is presented and the increase in the number of people or the dollars, the expense that we have, do you see that gap increasing or staying at a constant amount?
Well, again, this is a great question. I don't see that anything in the Trump administration would in the Trump bill would cause an increase on the revenue side. So optimistically, assuming that revenue is held harmless, the revenue is going to stay the same, and the costs are going to increase, or the transferable amount will increase, and so the gap will widen. Is my intuition. But
I was thinking not on the federal side, but thank you for that. But no, on the variety of options we're looking at on the Oregon side, that
yeah,
those revenues will change as we go forward also.
Yeah, presumably. I mean, this is this is goes to Mary's point about Oregon's much to its credit, its ability to dig under walls or whatever, climb over them. That's a great question. I mean, this is assuming that Oregon will have no response to this, right? But presumably lots of interested people in the state are working on that. So it's a great question. I'm not prepared.
Thank you.
Yeah, of course. In the interest of sort of push. Oh yeah, Cheryl. Sorry.
I know we need to move forward. We're a little bit behind, but this is a really great discussion. I just wanted to suggest that at some point we bring in Ways and Means co-chairs of our legislature and just talk to them about what their contingency plans are, because I know they have some. So
yeah, that
would be helpful to us and inform our efforts as well.
Would they come? That'd be interesting.
I'd be willing to ask.
Yeah, can't hurt to ask. Right?
Yeah.
Excellent. So I will follow up with all of you on these great suggestions. Speaking of great suggestions, this is really actually, this is not intended. I'm already feeling, I see John already leaning forward. This is not intended to be something that is read in this context. What this is the point was made by Cheryl that I'm sorry to call you out, Cheryl, but I think it's such a productive observation in terms of how to make this a user-friendly exercise, for the board and for just a general interested public. I think that it would be useful if there was a table like this that looked at, so you're not contemplating these changes to the tax code in the abstract, right? Do you know what the status quo is right now? What you're adding to the various sums. So my proposal was to put together a slide like this. For those, I think this is from, I put this together 2 slides ago, 2 meetings ago. And I'm proposing, I think it could use an updating, and it might serve the purpose that Cheryl had in mind. It occurred to me rather late in the game that it would be good to have, if this is envisioned as something in, say, a Word document that goes along with Charlie's tax calculator, maybe in a column like this, a list of the parameters that one has to toggle. In other words, the number of sliders that are available, the levers or something, that the parameters of the program that can be adjusted. So, I don't know. There are, of course, as you well know, difficult pulling this up. Let's look at this version. The employer payroll tax, for instance, has 4 parameters that one can toggle in a current iteration of this calculator, whereas the corporate activity tax has just a single tax calculator. So, what I'm suggesting is that a more comprehensive user guide would specify, that there are n equal 4 levers with which one might want to adjust, and then having a list of those and perhaps what exactly it is that they're doing. I understand that maybe it's less than fully clear in the sort of terse version of the model. So I just want to signal, I guess, that is something that's coming. The other thing that's coming is a revision along a number of lines. Again, I'm going to circle back to this, but I'm going to suggest that we have a jam board, my young colleagues used to call it, where people can put comments about bugs that they would like to see fixed in the tax calculator. One of the obvious bugs that Richard very kindly pointed out pertains to the sales tax. So the sales tax, so the fundamental observation is that the sales tax it looks in this iteration of the tax calculator far less revenue productive. It doesn't produce a lot of revenue even when you crank up the sales tax. I mean, a 6.3% sales tax is quite high. Obviously, it's much higher than the sales tax that Oregon currently does not have. And that only produces $2 billion in revenue. Where this calculator is coming from, and I went back and forth about just hiding all this stuff for everybody except for Charlie and other folks who really want to dive into it. But where this is coming from is a very simple analysis that looks at data from retail sales expenditures across a number of categories that seem to go into, I think they go into the national income product accounts, right? So these are sort of standardized government bins of retail expenditures. I exempted some that seem like things that usually get exempted: shelter, education, food at home, healthcare. And what I came up with in 2025 was approximately $40 billion in retail sales. So that's sort of the sales tax base to which the rate can then be applied to. I sent that back to 2022, the tax year that we're looking at, based on very napkin math, and got to about 33 billion. Charlie pointed out that the sort of national income product accounts at the national level, if you multiply the sort of the non-exempt retail sales numbers, right? So you take out medicine, you take out food, the things that are normally exempt from sales tax, and you get the national number. You do the Charlie trick of dividing it by 80. So that is 1 out of 80 Americans live in the state of Oregon. So, take the total American sum and you divide it by 80. What you get is something rather than $33 billion sales tax base, you get an $80 billion sales tax base. So basically, the 6.3% applied to a much larger base will increase the revenue haul. And I think, while the numbers that are currently in the tax year calculator come from a source, and I think that they're better numbers. And the implications of increasing the base along the lines that we just discussed doesn't get us to this RAND number. And I think Richard is probably the best person to speak to this if we want to dive into a little bit. But RAND came up with a very high elasticity, meaning that if you put a sales tax rate on this base, on sales taxes, you tax sales, you generate a lot of revenue. What we're seeing with the quote unquote Charlie number, with the $80 billion base, does not get us to that same sort of revenue generating potential, but it is, more than 2 times as high as what I've got here, with my $33 billion base. So in other words, just to be a little bit more concrete, I've got sales tax here in my example cranked up rather high to 6.3%, and that generates $2.1 billion in revenue in 2022. That number would be more than double if we use the more reasonable base that Charlie is suggesting. It would produce over $4 billion that could be used for universal healthcare. So that's an area that we're working on. Just to stick to my talking points, I'm already probably way over. I wanted to nail down, I don't know how the other conveners of this meeting feel about it, but I guess I kind of wanted to nail down, or at least give my thoughts, and submit for group discussion, how we can sort of backwards induct, move backwards from say a December deadline of transmitting a report to the board, Do we, and I'm not suggesting necessarily we come up with it here, but do we come up with milestones for the committee? I sort of view this as a first step, and now we've had, a sort of soft introduction to how this works. There are to-do items that need to be done in order to get the tax calculator ready for submission. The most obvious, perhaps, or one of the most obvious, is that this is all calibrated for tax year 2022. And we need to find what year we need to calibrate it for. Presumably, the idea here is that the universal healthcare plan will be implemented at some point in the future. Maybe 2026 is too aspirational, but it'll be done in 2027. And so we need to treat that as the year that we're producing the tax calculator for, which means that we need to forecast up all the separate line items. Another observation, yeah, Charlie?
I think we've kind of decided, at least previously in this committee, that 2030 is probably the year we want to
Thank you.
end up with estimates for.
Cool.
And the question is at what point do we move things to that year? And I'm not sure a good answer for when do we move them. So, but I think it's 2030 is a better year to think about.
That's great. I think I actually did know that at one point. And yeah, I'm totally seeing the problem. When do you move things, right? Do you nail things down in 2022 when you have the actual data and then move it forward, or do you? Yeah. So, did somebody else have a? Okay, I wanted to make up. So one other thing that was just so good that I can't resist. Bringing it up is that this, well, I'm not sure if this is out of scope for Echo. I think it's something that we are quite good at doing, and now with Milliman on board, probably, but between the team collectively probably has a lot more bandwidth to do this. But Richard's observation was that, oh, Richard, I'm not going to do this justice. Richard's observation is that this twice. Oh dear. And then I need to call up. How about this version? Oh dear. Window. About this calculator. Started to take notes on this here, but I think we need to move it to a document. Okay. So Richard's awesome observation is that if you look at employee-sponsored personal health care, the tax calculator, as it's currently set up, computes. Let's be precise, as Richard very usefully did. Take somebody who's earning quite a lot of money, $163,000 a year. Their total tax and fees under the current calculator is approximately $26,000. Okay. What this is not accounting for is the fact that they were paying deductions and premiums. Okay, and they would no longer presumably be paying that under the universal healthcare system. Therefore, it is sensible. So under the universal healthcare system, there would be an increase in the liability of such a person, the total liability, right? But if you remove the amount for premiums and deductibles that were currently paid in a multi-payer system but will not be paid in a single payer system, there is the increase is much smaller. Okay, and it's smaller to the tune of 50%. Which is an extremely politically salient, economically relevant observation. And so what I sort of took from this, what I kind of extrapolated was, there was an ask, oh my goodness. There was an ask at the board level from Helen, the chair, for an individual level calculator, right? That says something like, so the idea is an individual puts in his or her income, and it tells, it computes, prior to the universal healthcare, that is under the status quo, what this person would pay. And then it has an after, under the proposed universal healthcare plan, what such a person would pay. And, I can imagine that such a calculator would be extremely useful. And in particular, it would point out things like, precisely what Richard is talking about, right? It would account for all sorts of things like the fact that deductions and exemptions are no longer an expense under the universal plan. Yes, Charlie?
So I think there's kind of two different sorts of calculators here. I mean, and also I think it's somewhat premature to do too much with a calculator until we make some decisions about the taxes. But one sort of calculator is set up so that if somebody sits down with their W-2 form and maybe their bills from the year, they can say, well, how much did I actually spend? What would I pay in new taxes? There'd also be another one that is more general, which says on average, a person in your situation probably paid this much before and pays this much after. And so and those are going to be pretty different numbers in pretty different sort of calculator, because one is just going to use averages somehow, and we have to figure out how to do that. And the other one is going to use specific data that individual puts in. And so I think we need both of those. And they're going to be, but I also think that it is somewhat premature to do very much on that until we make some decisions about taxes.
Agreed. Yeah, that's super helpful. I actually thought you were going to say there were going to be two tax calculators, one for individuals and one, sort of the exercise we're doing at the aggregate level. But in fact, following that logic, there's like three, right? There's two individual level ones, right? One is very precise for a individual with very specific parameters, and then there's one like an average individual one, and then there's the aggregate revenue calculator. Awesome, Mary.
I think that somewhere when that question got brought up, then there was a response from Echo. I think someone saying, "Oh, that's rather simple," and I'm kind of going, "Really?" I don't think it's now that simple, but anyway, I thought that's kind of what had been agreed to, was that individual calculate. I mean, we get asked a lot by people like, well, what does this mean? And I agree that we've got to make the decisions on what that income tax is going to be, those kinds of things before the calculator can be done. But I'm also, not so sure that, although, you hear an anecdotal, like, I'd like to know how much this is going to mean for me, versus more someone in this range, this is what it's going to look like, in terms of the amount of time and effort and whatever. I don't know. I just think there's a relatively few people, there are people on this committee that are going to sit down with their W-2 or whatever, but there's not a lot of the general public that is going to really sit down and calculate this. They're going to want to know kind of in broad strokes. And this is not really the issue for this group or even the board, that I just don't, that's a relatively small group of people that's going to really intellectually think this whole thing through. And it's going to really be the opposition, I think, that will think it through better to try to show how terrible it's going to be. But I think the majority of people who are going to go, geez, lots of other countries do this. Why shouldn't we do it? It's really the right thing to do. If they vote, check mark, and it's over. So anyway, I just kind of some ramblings as I think about.
I find that compelling, actually. I mean, Charlie, from a purely technical perspective, Charlie's point absolutely makes sense to me. But I hear that as well. That yeah, I wouldn't sit down with my W-2 for work.
No. Anyway, that's all.
Yeah, thank you, Cheryl.
First, I wanted to thank you for slide 4, and really appreciate the status quo taxes and revenue, because that will help kind of the average person figure out what, what's possible. And so I really appreciate you hearing me on that one. I wanted to mention a few things. So first, I believe the board asked for not only individual/family calculator, but also for employers. That was another category. So I just wanted to add that.
Thank you.
And then the other thing I wanted to say is that I think this is a really good intro for revenue options part 1 and 2. And I think at this point, I'd like to suggest we take our break closer to 11 because we're pretty late. So as you wrap this up, we'll just move into the revenue options right away. And again, this is a very good intro, to that topic. So
Mr. I was going to hop on real quick. One
Yeah.
option on the break is I could do a quick overview of the homework and then just queue up John, Jeff, and Richard.
Oh, okay. Yeah, good idea.
That they're on tap to kind of talk a little bit about some of the ideas that they submitted.
Okay.
You
That
do that.
sounds good. And one other thing I meant to say is when I looked at that, the Excel spreadsheet, I think that Richard suggested with the premiums and the deductibles that an individual or family would be saving. A lot of us are covered in small group plans, and I can tell you our family deductible is up to over $10,000. So I think maybe for that there has to be a range too. I mean, because the deductibles are just out of this world right now.
Yeah.
So just want to add that. John, go ahead.
Yeah, I'd like to emphasize the calculator we need is the calculator that the Universal Health Plan Governance Board negotiating team will take, hopefully before the legislative session, well before it, to employers, to hospitals, to physician groups, and say, here's where we're at. Here's how this works. Now, what can you do to make these numbers even better? What can you do? And look at what happens if you can do more of this or more of that. And in terms of the tax that individuals are going to have to pay, and legislators are going to be thinking about. And I don't think there's ever been a legislature when it comes to health that doesn't ask, have you sat down with the other stakeholders and where are they at in terms of supporting this? That negotiation is what's key for any startup. So that's the important calculator, which we're making progress on, thanks to Charlie and Richard and Will. I mean, I think you're really making progress here, and they will, believe me, they will look at that, they will understand it, and they will have people probably who are as good, if not better, at looking all those variables and making suggestions, which will be a good sign. I think there will be employers who will do it if we look like we've done our homework and are credible. So there you go.
Right. Thank you, John. So I want to spend just a few moments here just to introduce the discussion here we're going to have in the back half of the meeting. So I'll leave this up, but I want to queue up John, Jeff, and Richard here to talk a little bit about their thinking in some of the proposals. And just FYI, I gave you each all some slides with, I just got rid of that. Give you all some slides to kind of reference in the background so people can see it while you chat through some of your thinking. So I would say, picking up from last meeting, what we heard was the committee needs some time to find some space to talk about the proposal, right? Particularly with respect to trying to raise a certain target revenue, but then specifically about how they view each tax as a component in relationship to each other. And so big thanks to Charlie for obviously building this piece, and Will did a little work here to try to hopefully make it a little user-friendly. Some folks were able to sort of spend some time, and I know everyone's got a busy summer schedule, but I think this first piece is really trying for us to, I would say, have the committee members talk to each other about their thoughts around how they would sort of optimally construct this, get some feedback, and then hopefully what we would love to see is us starting to come around with some themes. What are we seeing with, like, oh, where are people sort of placing their emphasis, the relationships of the taxes, what taxes are not included or should not be included, and why, and to create some space for that. I think, this may stretch a bit, but I think this is sort of the meat of the conversation. Go ahead, Charlie.
At some point, I still are going to emphasize we need to talk about the nature of the taxes and not just necessarily the amount that each is raising. And so hopefully that's part of what we're going to be doing today is
Yes, exactly.
nature as well.
What I want each member to be able to do is to talk about sort of that nature of that and why they constructed it in a certain way, and have some deliberative space. So I would say we're trying to get out of the way here to let you guys use the vehicle here to have that conversation amongst committee members, so you can kind of move this forward. And so with that, I think I'll leave this up a little bit so you can kind of see just a little bit just from since everybody kind of gave some different kind of response or the formats, I try to just normalize it in terms of the revenue raised. And so we'll have a bit to sort of talk about sort of the nature of the tax, how they feel it should work, and why. I want other committee members to ask questions of folks when they do their sort of quick overview of their thinking. So just when we come back, Richard, I'd like you were probably provided the most deepest sort of explanation and thinking in the response. I'd like to follow that up with Jeff, and then John, you put together 3 great sort of scenarios. So close it out with sort of your thinking around sort of how you constructed those 3 pieces. And we'll use that as sort of the basis of our conversation after the break. All right, Cheryl, sounds good?
So you're actually taking us to break early then?
I think so. That way we can take if it's okay. I think it makes sense, and give folks a little time to kind of get their mind around their homework again, and then we can kick off the last hour and a half ish talking about their proposals.
Okay, are you okay just coming back at 10:30 and just 7 minutes? Is that all right? Okay, all right. Just like to use round numbers, so.
Great. Thanks, Carol.
Okay, see you at 10:30.
Right.
Hi, all. I'm gonna assume people are back, and we'll go ahead and get started because there's a lot to discuss here. So Morgan, I'll hand it over to you.
Great. Well, I'm going to quickly get out of the way and let Richard talk through his proposal. But Richard, just so you know, I kind of took some summary of your notes here in terms of your rationale and design, but I'll let you speak to that. I also have, why does it keep? Also, then just have a quick summary of your target. And just FYI, I don't know if it was a copy and paste when you sent the cover sheet, but the total of the revenue sources is in excess of the 22.5. And so I don't know if there's a correction in there that we need to account for, just FYI. So,
Morgan, you said mine was in excess?
In excess, yes. If you look at here, you're kind of right about 31 billion. And I don't know if that was just a copy, if there's something happened in the transcription of the copy and paste that you had sent on the cover sheet versus kind of what you're working on. So just FYI, when I'm showing here is at 31, you can kind of see the big one being the employer payroll tax, significantly a little higher relative to the personal income tax pieces.
Yeah, I wanted to look at it because something doesn't make sense there.
Yeah.
So many comments.
Yeah.
The first thing I'd say is if you look across the 5 proposals there, they're really pretty close. We all shot for somewhere between 19 and 22.5. So that's, but also so many of the lines are not different. And that was my first point, is when you look at the calculator, there's only a couple things, maybe three, that really raise any money. And that is the employer payroll tax, the personal income tax, and the personal premiums. Now the sales tax is in there, but it just doesn't raise much. So you really don't have that much to tweak. And that's why I didn't offer three, is because I'm just tweaking the little stuff if I tweak anything. So that was the first comment. We really don't have that many ways in to raise the money. Payroll tax, income tax, and sales tax. I'm sorry, payroll tax, premium, and then the employer, and then payroll tax, income tax, and premiums. That's kind of where the money is. Yeah. Still, let's go back to the one that shows all five there. So there's something not right here, because you see that John's first option and my option are very close, or are similar, except for the whole employer payroll tax. So I'm not sure what happened there, because part of it is, what is the employer payroll tax? But then there's also a thing of how much of the employer payroll tax counts against the personal income tax. And I wonder if John and I had different settings there, because I don't recall raising 31 billion. That'd be way too much.
Yeah, I figured that was probably the issue, is the relationship of the payroll tax with the income tax, but I wasn't quite sure there. So
okay, now we can go on to the next slide. I think then we'll have to come back and figure that out. So like others, one of the things going in was that the employer payroll tax aims to match 80 to 90% of roughly what employers are spending right now, and that I gave it a full 100% credit against personal income tax. Now, as has been pointed out before, we're just dealing in averages, that generally in 2022 numbers, employers were spending on the order of $9 or $10 billion on average, and that we're raising, or my plan raised by payroll tax about $8.7 billion. But we need to keep in mind that's on average. Any given employer could be wildly different. Like if you're running a small firm, you didn't pay anything in terms of premiums for your employees, perhaps, but you're going to pay quite a bit in terms of payroll tax. So we need to keep in mind that on the employer side, it's an average, and any given employer may be wildly different. There is I went in there and tweaked each one to say, does it make a material difference to do the slider? And the small business threshold does raise a lot, even up to $1 billion more by lowering that threshold. So that, like Charlie has asked for many times, we need to have a discussion about that. What do we want to do with small businesses who probably aren't paying right now for any premiums? Because if you lower the exemption amount for who doesn't have to pay a payroll tax, you could raise significant more money. And by saying that, I mean like on the order of $1 billion, because that enters the discussion. Another thing that I noted on the personal income tax is the idea, and again, this gets to Charlie's point about arguing about the merits of each tax. If you have a high income, like really high income, like $500,000 or $1 million, you're going to be paying up to $100,000 in terms of healthcare personal income tax. And so the question is, does it make, generally it costs right now roughly $25,000 a year to pay for a family. That's not premiums. That's what it costs for the healthcare for a family, is about $25,000 a year across all averages, whether you get sick or don't get sick and all that sort of thing. So does it make sense to charge someone who has a very high income 4 times that, calling it a healthcare income tax when it's 4 times more than their healthcare costs on average? Now, I understand we want it progressive, and going with the Taiwan thing of saying that it's generally want to pay for healthcare based on ability to pay. Still, does it make sense to charge high income people 4 or more times the cost of healthcare in a healthcare income tax? And so I brought up the possibility of altering the calculator or putting an option in the calculator, say, once you've paid $50,000 toward healthcare for your family. I'm going to deal with families because it's just easier as a shorthand. That once you paid $50,000 toward healthcare for your family, then you don't pay any more tax. Again, that takes money off the table and it's significant, but I think it's one of those things that we need to talk through. The fourth bullet there is we put it too high. People of high income will leave the state, and I think that's significant. We've already talked about the sales tax expecting to play a bigger role. We need to come back, but still, we're only talking about somewhere between $2 and $6 billion. And now with the OBBBA loss of income, I mean, we're off by 10 billion, not just by 2 to 4 billion. So let's go to the next slide. I think we've talked. I'm not sure the next slide we needed to spend any time on that. I think we've talked through all that. I'll yield the floor to other people for comments.
Yeah, so I want to make sure we open it up here. Richard raised a lot of good points, and it'd be good for folks to make sure they understand where he's coming from and any follow-up questions. So, Charlie.
And so, I mean, to me, it's pretty easy to see where the discrepancy is coming in as far as the total revenue, and that's that Richard is giving a number for the amount of money that's raised by the employer payroll tax, but he's also giving that 100% credit. And so, for the most part, all of that money is not revenue raised because it's going as a credit towards the personal income tax. And I don't know quite where John's numbers are, if that's also there with his numbers, but it may or may not be. But certainly in Richard's numbers, that's where most of the discrepancy is coming. So related to the 200K firm threshold, yes, if you lower that, then you raise more money. But if it's a credit, you don't really raise more money. And so in many ways, the money raised it's irrelevant whether it's paid by the firm or by the person if you have 100% credit. So I actually think that Richard's worries about the 200K firm threshold not raising as much revenue as we might otherwise it doesn't really matter because their money is really raised by the personal income tax. And so I actually think it would be okay to put it higher than that. But that's one of those questions I think would be best to engage with small businesses to find out what do they think. And what do their employees think? Do their employees want their business to pay more of their personal income tax obligation or not? So that's essentially related to the notion of the 100% credit. And I actually, as much as I love progressive taxes, I agree with Richard about having a cap. And I don't. It doesn't say the soft cap rate is 8%, and I actually think it could be quite a bit lower than that because that's still a heck of a lot of money for somebody that the 30,000 tax filers that have an average of 1.2 million in income. We'll come back to that. But I actually think a soft cap is useful as much as I dislike it. So I'll stop there.
Richard, then Mary.
One other thing I want to bring up is looking through that spreadsheet and adjusting rates here is that I know we want it in general to be progressive, but if you factor in what people pay, we're talking about employer-sponsored private health insurance, even for low-income people, or especially for low-income people, if you factor in what they pay for premiums themselves out of pocket, meaning a deduction from their paycheck, that side of the employee paid premium and what they pay in out-of-pocket costs, the people at the low income on that calculator get a great deal. I mean, at a $50,000 income, basically they're going to pay $800 more a year in taxes, but they would have probably paid, again, depending on their plan and whether they're talking about individual or family, but they would have paid $3,000 or $4,000 in terms of premiums or out of pocket. So they're getting a sweet deal, whereas relative to healthcare payment versus someone at the high income, say at at $500,000 that is paying $50,000 or $75,000 for healthcare when they only would have paid $25,000, where they only would have paid $7,500 in terms of personal premium and out of pocket. So I think we need to we want to make it generally progressive, but the way we've structured it here with very low taxes at the low payrolls, I mean, at the low income side, is it's given a substantial break and it puts them better off on a universal health plan than they are currently. Again, for employer-sponsored private health insurance. So I think we need to look at that. We want it to be progressive, but we can't go so far back that they're getting a better deal under United Health and a universal health plan than they are currently. That just it makes it too big a load on the high end. Over.
Go ahead, Mary.
Okay. Can we go back to that slide that had that one? Thank you. Are you saying that Richard, that the 8,733 number that's really
Sorry, I was trying to highlight it, but
oh, that's fine. This I see it right here. Okay, it's in that fourth column over, third down. 8,733 compared to John's 2,304 and the 1,900 one, and even Jeff's 4,000. Explain to me why that number is, because it's the thing that makes it, if you add it up, to be 31 or 32,000. It doesn't add to 22,492.
Yeah.
Help me understand what that is.
What's not on this screen is what percentage of the employer payroll tax goes as a credit against that person's personal income tax.
Okay, let me ask a question about that. If most people nowadays, I think we're all probably exceptions, do not, they just use this general, whatever you call it, deduction when they do their federal tax. They don't itemize. So is this whole thing about the payroll tax and 100% and all of that for people who itemize? Or is it,
No,
I don't understand. Maybe I just
it's
don't
not a
understand the
deduction, it's a
basics.
credit.
A credit. Okay, just a credit. Okay. All right. Thank you.
so I would assume, Mary, somewhere on the state
Yeah, there are credit. Yeah,
income
at
tax
the end.
act, you would identify some amount that's probably on your W-2 as a credit against.
Credit. Yeah, thank you. I got it.
So just to be clear, that 14.1 would go down because it's not showing the debit of the credit against the personal income tax.
Yeah.
To get us to kind of that amount.
Okay.
Most
my other point, and I think this is a kind of the basics of what I thought the marching orders we had was that we were not going to have premiums, and everybody's putting premiums in. So I guess we have to have a discussion about premiums, because we've got administrative costs with premiums, the collection of them, all that whole business. And so there's a piece of me that's kind of going, oh, I didn't think we were doing premiums. So help me, John, and everybody else.
And I think I can speak to that because I was the one who kind of put them in the calculator. So these premiums are premiums in name, but they are collected at tax time. I mean, they're basically another way to say this is the amount of tax. And the difference between the income tax and the premiums is that the premium is based upon the number of people in your family. And income tax typically goes down as you have more people in your family, and a premium would typically go up as you have more people in your family. And so the way that I have structured, so there's a couple of different things with that premium that are choices that we can make. First of all, do we have them or not? But another choice that's in the spreadsheet, and I assume most people just let it be, is how are those premiums determined? And so the way I structured as a default is that nobody pays any premiums below 400% of poverty level, federal poverty level.
Yes, I got that.
At up to 800, at double that, whatever the number you choose is, at double that, you pay the full premium, and in between you pay relative to how much you are, what prorated amount you are between 400% and 800% of federal poverty level. And so for low income people, they don't pay any premium, and it's only pretty high income you pay some. And then for really rich people or really high income people, they pay more when they have a bigger family.
Okay, I just think maybe the word, I would recommend that we not call it premiums, because it gets into kind of our current insurance mind that people are paying premiums. And so it just confused me. Thank you.
Well, I guess in some ways people are saying, oh, we shouldn't call it a tax. We should all call everything a premium because you're paying it for healthcare. And people are seem to dislike taxes more than they dislike premiums, but that may not be true. And so to me, it's just a way to distinguish between the income tax and per person tax, a head tax.
Okay, income tax 1 and income tax 2. Okay, something like that. All right.
Well, a head tax maybe, or something.
Yeah,
I don't
or
know.
something, but that's fine. I just thank you for explaining it to me. I somewhere missed that along in our previous discussions. Thank you. Because with the concept, I agree with you, Charlie and Richard. I think that makes sense. I guess I also want to ask a question about Richard saying that, am I correct in hearing you say that $25,000 per year is the average healthcare costs, including premiums, deductible, all those things for a family? Is that?
Yes. Yeah.
I thought correct me if I'm wrong, but I thought just the premiums people were paying were, getting us up, to, $1,500 a month, or, I mean, an individual. So I'm kind of going, where is that number? That just seems low to me.
Okay, we'll work it up.
Okay.
And I can speak to that very quickly as well. So 25,000 would be about right if you look at the per person amount and the average size of a family, which is a little over 2 people. I mean, on average, it's a little over 10,000 per year of expenditures, and that's probably 2022 numbers. And then 2.3 people or something like that. So
Okay.
it's somewhere in that neighborhood. But if you have like a family of 4, then it's more than that for total expenditures.
Okay, thank you.
That sounds consistent with what the Portland Bureau of Transportation was paying for a family.
Okay. Thanks.
Okay. Any other questions for Richard, or Richard, any other things you want to highlight? I think you did a nice job of kind of like providing some overall summary and some connectivity across the taxes, and particularly around sort of Charlie's question around the nature of each tax and the relationship to each other.
What I'm struck by is frankly, there's just not a lot of wiggle room. If you're going to raise $22.5 billion, there's just not a lot of wiggle room.
Right.
So, anyway, over.
Okay. Great. Jeff, you're up next. Oh, there we go. Oh, do we still have Jeff?
There we go. Why don't you go back to showing all the comparisons? That'll be easier, I think, for the conversation.
Yeah, for sure.
First, I will apologize. I was targeting about 19 to 20 billion, so I would need to revise my numbers to get it up to the 22.5 or possibly higher, depending upon the conversation we've had earlier today. Secondly, I agree with the comment from Richard that when you're looking at the scale of the numbers, whether it's 20 or 22.5 or 24, there is not a lot of wiggle room. There's only so many sources you can get. I'm going to keep my comments brief because I'm not going to have much to add. Let me just note on a couple of items of where I put the numbers in. With just the 3 of us reporting back on this, I'm hoping after today's discussion that the other members of the committee go to that spreadsheet and send in their comments so we get a more idea of where the rest of the committee is. But I went 0 on the corporate commercial activity tax because to me, it's just a basic question is that the commercial activity tax is charging businesses who may be losing money and having to pay a tax even though they are losing money. And I just have a problem with increasing that burden that is there. So that's why my number came in at 0. I'm on the same page with John with respect to the sales tax. I'm an outlier on the lodging tax because I like to see taxes as a general statement, have some relation to the activity that's being funded. And I do not see a connection at all between an increase in the lodging tax and funding single payer universal health care. So I've had put that number in at 0. So other than that, nothing else to add other than what's already been said.
Go ahead, Cheryl.
Just a comment that I thought I read somewhere, that the lodging tax would be for people who are visiting Oregon who aren't technically covered by universal health care. I think that's what I understood. Is that correct?
That was the idea, I think, initially, was to have some nexus to sort of out-of-state folks, and even the sales tax to some regard. But, you know, that, remember, lodging tax has a significant portion of just in-state Oregon travelers, right? So people just doing local vacations. But it does provide you, Bobby, an option to, access that.
And the dollars are really small in any event.
Yeah, and I think the same goes with all the I think you guys talked about some of the sort of sin or vice taxes, meaningful from a sort of public policy perspective, but from a revenue generation, it's kind of in the rounding error kind of exercise given the sums we're talking about. Charlie.
So Morgan's comment about the lodging tax is pretty much, and Cheryl's comment is pretty much what I am envisioned with that it's to make up for the fact that when people are visiting Oregon, if they need emergency care, it has to be provided, whether they can pay for it or not. And so there's an excuse for having it there. But I also agree with Jeff. It's kind of a flimsy excuse, but there is a connection there. And I would say the other reason for having it is, I mean, the main reason I would say for having a sales tax is to say, oh, people from out of state are going to help with that because it's not just in-state people paying it. And so the lodging tax is a way to say, oh yeah, out-of-state people are going to be helping pay for it a little bit, even if not very much. So I think there's an excuse for it, but again, it doesn't raise enough money, so I could go either way on it. Another reason for using it is it exists already, and so it would not require new infrastructure and more money to set up the administrative thing of getting that money. So that I'll stop there.
Yeah. Go ahead, Mary.
I agree with Charlie on that we don't want to set up any, and that's the thing, I'm against a sales tax, not just because it's been voted down every time, et cetera, but it's because the complications of setting up and administering a sales tax are significant. And when we don't have it, if we already had one and we were going from 5 to 8% or something, we're going to jump it up, I would be for it. But for the lodging idea, something small, increase in it. Also, I guess the sin taxes aren't on here. And I go back and forth on just watching the vehemence and the unbelievable ability of the beer and wine tax folks to be able to keep it from happening from 1974 until today. But people with alcohol addiction issues, have significantly higher healthcare costs. And there's this piece of me that makes some logic to, saying that we're going to finally increase the beer and wine tax in this state, and that it's going to go to this. But anyway, that's just kind of my philosophical issue that I've been arguing, that one for many years, and we've lost. And so then on the other side, I can argue that the lobbying, when we go forth with this, to have, absolutely every group that has, well-funded lobbying opposition for a small amount of money, is it better to just leave it alone than to actually, poke that bear too? So those are just some of my thoughts.
Great observations, Mary. I just wanted to throw in one data point that apparently in 2022, alcohol, cigarettes, and marijuana sin taxes generated $500 million at the state
Yeah.
level.
Yeah. And that's alcohol, but the specific beer and wine is a
Okay.
piece that, you know, we did increase, as I understand, alcohol, hard alcohol taxes, but
Okay.
the piece of beer and wine, it's not a hugie, you know, but it really has just been something that in public health and alcohol services, et cetera, that is, I've kind of watched it over the years and fought that battle.
Yeah.
All right, I'm gonna move us to John here. John, I think probably the easiest way maybe is just to keep this slide up a little bit. You can talk through sort of your thinking on your overall approach and some of the variations between the options that you put together.
Before we go to John, I have a question for for Jeff, and that's what did you do with the payroll tax and the amount of it that is credited on the personal income tax?
Can you elaborate? I'm not quite sure. What do you mean by what did I do?
So you're showing some money raised from the employer payroll tax, but if there's a credit, if it's 100% credit on that, it's actually not raising money. And so, and Richards shows raising a whole lot more money, but he also said I chose 100% credit on that, so that it's not really raising any of that money or very little of it. And so I'm wondering what credit. What fraction of the employer payroll tax are you thinking should be a credit on personal income tax?
Yeah, when I
Or did
was
you look into that?
Yeah, I will look into that. When I was going through and playing, and I mean playing in the best sense of the word, with the terrific spreadsheet that you sent, I was moving numbers around to get to a target overall number. So I wasn't delving as deeply into the some of the, if you will, downrange implications of it. I was trying to focus on getting to a the overall, 19 to 20 billion.
Okay.
Not a good answer, but it's the one I've got.
Okay.
May I steal your screen for a second, Morgan?
Yeah, go for it. You got it. I was going to ask you the same thing, Will, but
Okay.
going where I'm going. Perfect.
Okay. Just with respect to oh, not this screen. So bad at this. Stop share. Share.
We've all seen screens like that.
Yeah, if you knew how many windows I have open right now. Just with respect to Charlie's comment, Jeff, here I think is the relevant slider, right? This slider controls how much of the employer payroll tax is creditable in the personal income tax calculation. So it should be the case. Oh, no, I'm a bit surprised. All right. Okay. So just to be clear, what I'm doing is I'm increasing the percent of the employer payroll tax that is creditable, and what I'm expecting. Oh, I see. Okay. What I was expecting, just for sake of clarity, is that this number would be going down. Okay, but that calculation actually, I think, following Charlie is taking place in another spot. I think perhaps Charlie, correct me if I'm wrong, Charlie, but perhaps it would be more transparent if it were reducing the amount here, right? I mean, I think your math is correct, Charlie, but I think
if you go to the top of the spreadsheet, the rows, it's
I think what you're doing is I mean, we're getting in the weeds here, but I think what you're doing is, I've buried it. I should pull up your version. I've buried it right. Not sales tax. I'm taking it off right here, I think, and then that's reducing it here.
Yeah,
we're getting.
I think in my spreadsheet I think I had something towards the top that had a
you pulled it. You had it like in a separate thing right here. Oh, let's see.
Yeah,
I just buried it. Yeah, I put it right there.
Yeah.
This is what you had in a separate thing. Yeah. So it is correctly taking it out there.
Yeah, but I'll have to look at what makes the most sense for ease of use, and I haven't quite figured that out yet.
I'm not sure that I improve things in a lot of circumstances. But just to close this loop, Jeff, right? So this is a parameter, right? This 84% here, and as we discussed, Richard cranked this all the way up to 100%, right? So everything that the employer pays is a reduction in the total liabilities, in the total amount that's available for universal health care. And obviously that matters. It matters because it sort of, as Charlie also pointed out, that it renders the threshold exemption for employer payroll taxes moot. So it's an important thing. I think what this is really pointing out is that, in a comprehensive user guide that, walks the user how to do that, this is an important thing that needs to be called out because it's a little confusing.
All right, John, you're up. Let me go ahead and share back.
Mary Lou's raised her hand.
Oh, go ahead, Mary Lou.
Oh, I had a high school debate coach that would be absolutely freaking out if she were alive. Do not display your ignorance, Mary Lou. Okay. But I'm going to do this again.
It's not a debate.
Okay, on the employer payroll tax. Explain to me again, is it really the employee that is paying this tax? And not it confuses me that it's called an employer payroll tax. I would like the employers of this state to have to pay something. And maybe the corporate income, or is that where it's at? But it's like, why would there be a personal credit if I were employed, and it had been taken out of my paycheck, and then it's not really the employer that's getting taxed? Am I totally?
Go ahead, Charlie.
I'll answer that. So my reasoning is, whatever an employer pays for employee health care is essentially a benefit to the employee, and therefore it should be considered as essentially like wages. It's part of their compensation package. If the way I've envisioned it is that the employer pays the payroll tax, but if that was not credited on the personal income of the employee, then that wage would have a tax because it's part of payroll, but also because it's part of income, and so it'd be double taxed. And in order to avoid double taxing, I think that there should be a credit, and this is how I've designed the system at first, was there was 100% credit of whatever the employee paid on behalf of that, whatever the employer paid on behalf of that employee was 100% creditable to that employee. And so it was not double taxed. And so to me, that's a really important piece, that we don't want to have wages taxed at a higher rate than anything else. So in this sense, the employer is paying it, but it makes it so the employee is not paying it again when they get the wages. And to me, that was the biggest problem with what was put forward with the in the task force, is that they were double taxing wages. And so I wanted to make sure that that was avoided. Now, the way I set it up, the employer payroll tax has slightly different parameters than the individual. So I didn't really want to have to say the employer needs to have the full information of about how many people are in the family of that person. So I just did it based the exempted amount from the employee or payroll tax for each individual is based upon a single person's federal poverty level. And so it's the employer is paying it. And why do we even do that at all? The only reason for having this separate tax is, my understanding is that helps with federal taxation. That if the employer is paying it, they aren't going to be paying taxes on what they pay for their state taxes on payroll tax on their employee. But I don't know if that's true. And so we need to find that out. So that's actually another legal question. If the employer pays the employer payroll tax, is that taxed as part of the
Corporate tax.
corporate tax, federal corporate tax? And I think the answer is no, but I'm not sure of that. And I need to find an answer to that. I'll stop.
Thank you for confusing me more. Okay.
But
Well, I'm inclined to agree with you, Charlie. That's my understanding as well. But I also agree with you that this is something that should be checked and not assumed.
yeah, so Mary Lou, maybe I think and let me take a crack at maybe your question is, there is a difference between sort of who pays the tax, right? Who's writing the bill, right? We call that typically a first incidence, right? Like who's in charge of writing the tax bill. And then there's the sort of final incidence, like who actually is bearing the ultimate cost, right? Like what is it being passed through? So the economic, and jump in here, Will, but the economic literature is pretty clear that um, most payroll taxes really are really, even though they're paid by the employer, right? They are really sort of born ultimately on employee compensation. And so what in designing this chart in a chart very smartly, I would say, is trying to avoid anything that would unduly tax compensation, right? Because that has downstream impacts on sort of wealth and the economic competitiveness, right? And so here the payroll tax, right, is a way for business to get away from that disincentive, right? Is to do that. But because ultimately it's a tax on compensation, what Charlie has designed is a way to credit that against employees. So employees don't get hit twice, right? Oh, well, you have to pay me less now because you have to pay this payroll tax, right? And so I have less compensation. And then I get taxed again at the personal income tax in order to pay for this. And so it's offering that as a deduction. So we're not double counting both the employer payroll tax, even though it's paid by the business, but ultimately is going to be borne on compensation, and you don't want that to show up also in wages. So think of it as sort of the dual side of those things. Hopefully, does that help answer maybe what your question is?
I'll think on it. Thank you.
Okay. All right.
It's the wording, it's it's my wanting, and so explain to me, all of you, is it in the corporate income tax? Is that where we hit the employers? That, where is it that the employer that has been getting away with not paying for health insurance for their employees?
Yeah.
That we
It's that
get.
it's the employer paid payroll tax. So that's what I wanted to come to, Mary Lou, is that it doesn't come out of the patient. It doesn't actually come out of the employee's side of their paycheck because it's paid by the employer. And so that's how we make up for the fact that they're no longer paying health insurance premiums on their employees. So that's crucial that you understand that, because that's what changes all of it. And we're just trying to adjust the payroll tax paid by the employer to be about, on average, what they would have paid in premiums for their employee.
Yes.
This idea that every benefit for the employee that's paid by the employer comes out of the employee's wages, that's conceptual.
Yes, it's not that's what I'm saying. That's a concept. That's not real.
It's not. We can argue about how real it is. In a perfect world, as soon as you took away premiums from an employer that they paid for their employee, everybody's wages would go up by that amount.
That's a bunch of crap. I don't believe
it's not going to happen. So in that sense, it's a giveaway. It's a giveaway to employers, and we're trying to take it back by using employer paid payroll tax.
Okay.
Cheryl, then Charlie.
I think Mary Lou illustrated this very well. The same thing I had been thinking as I was going through this and trying to do this homework, and was having a really hard time with it. And I think we need the rationale and the assumptions that you all were just talking about right here to be noted on these summaries, because it's very confusing. I mean, if you don't have this background in taxes, it's really hard to even know you know, what
How
to
to
choose. I mean, I felt like I was just trying to take a shot in the dark. And then I think along with this explanation of your assumptions and your rationale, the slide 4 that Will showed us where we see the status quo of what we're paying and have a range too, like I mentioned, especially there's so many differences between small businesses and large, or small employers and large employers. I think we need ranges too. So with all of this information, I think then we're building the case, you know, for one or two of these proposals that we would then recommend to the board. So I think we need all of that to really make the case.
Yeah. Go ahead, Charlie. Thank you, Cheryl.
And so to sort of respond to some of what Mary Lou was saying, you know, if you don't believe that what the employers pay in a payroll tax is part of the compensation that would otherwise go to employees, it would be even worse that not only are you taxing employers, you're also taxing employees. And this way we're saying, no, you're taxing employers. And to the extent you're taxing employers, it's that much less that the employee pays. And another way to look at it is look at somebody who is making only retirement income and look at somebody who is making wage income. And the person who is making wage income is going to be paying a whole lot more if we do not have 100% credit on that, on the employer payroll tax.
Okay, you're helping me understand it. I'm still not totally.
I am in complete agreement with Cheryl that you know, a good user guide needs to explain this clearly. I think Mary's pointed out. I'll take a stab at it, and maybe we can make it a
I'll help write it.
What's that?
I'll help write it too.
Oh, that'd be
It's very
wonderful. Yeah,
important.
yeah. Good.
I have one more thing about as we discuss small employers versus large employers. I think that sometimes we think small employers are, you know, have 3 or 4 employees or have, you know, small numbers, but they could be, I hate to pick on lawyers, but it could be a small law firm that makes a bunch of money, but doesn't have many. So I'm wondering if how we define, you know, kind of the employer, whether it's by size of their company or their amount of money that they earn, kind of thing. So just a question.
Go ahead, Charlie.
So in the spreadsheet, in the way that I've set the spreadsheet up is defined by size of payroll. And so what you're choosing is the amount of payroll that is exempt from the payroll tax. And you know, my default was at 200,000. And so you could have, you know, it could be half of a high paid employee, or it could be 2 or 3 lower paid employees. And that's a variable that you can choose, the amount of payrolls that is exempt from taxation.
Okay.
And so there's a number of reasons for that. One of the reasons is if you do it by number of employees, there's jumps, and that makes it incentive to say, I mean, there's a lot of reasons why, I forget what the numbers, maybe 20 employees. There's some changes that occur in federal tax law with 20 employees. So there's a bunch of companies that have 19 employees.
Right.
You're so clever.
And so we don't want any jumps like that.
Yeah.
So that's why it's based upon payroll size, not
Good.
number of employees.
Okay. Thanks.
Okay. So, I think
Oh, no,
I'll
sorry,
start out.
sorry, John. Excuse me. Too many J's.
I think I'll start out by saying I'm like Jeff. I approach this kind of from a gaming point of view, though I don't play video games. But I know from a math point of view, I tend to start from the answer and try to work my way back. In this case, and I try to minimize the number of variables in order to figure out how something is working. So I started out with one. I'm a no sales tax guy. I'll let the rest of you figure that out. I am, by the way, a sin tax guy. And I was disappointed that more sin taxes weren't up here. Number two, I felt it was important that lower income people be protected in a variety of ways. And so I made adjustments when I was given the opportunity to try to reflect that. Up to, I think, 400% of the federal poverty level, et cetera, et cetera. So I wanted to protect low-income people who weren't in Medicaid and were buying their own insurance. The third thing I did, which hasn't come up yet, is I noticed that little indicator when it came to employer payroll tax that said whether the amount of money was under or over what employers were paying. Okay. So in my first two options, you'll see those numbers are essentially the same for employer payroll tax. The option 3 is I decided, let's really give employers an incentive to embrace this. And, now I knew something big was happening behind the scenes in employer payroll tax because I reduced the employer payroll tax by $1 billion. And it didn't reduce it that much in terms of that 1919. That 1919, if I'm using the calculator correctly, would enable those negotiators to go to employers and say, overall, employers are going to pay $1 billion less in taxes. Okay, so this is good for you.
Yeah.
Come on, take a serious look at this. Because I think it's so key that a substantial number of employers be on our side. So that drove that number along with the discussion you're having now. I'm involved in another project around digital health literacy for people 75 and over, and I'm 74. As I listen to this discussion, I believe my recollection is I kept the 71% number there constant because I couldn't figure out how to raise it. When I see Will, you playing around with that, I don't think I figured out for that bar how to move it. I'm not quite sure why that is. And as I think all of you know, don't ever make the assumption that whatever you do is intuitive to anybody else when it comes to digital stuff. But at the employer payroll tax, I was very pleased that those numbers are an employer payroll tax that is equal to or significantly less than they're paying now. And I thought that was a positive. The next thing I really went to was personal premiums. And again, I could tell when I entered a number, I would enter, I think I did 5 billion and 10 billion or something like that. And a much smaller number would end up on, my column there. So something was happening in the background there that I don't quite understand. I think what it may have been is there's a sliding scale by income level, and the big number at the top was what the highest income folks would pay. I do want to emphasize here that no one has answered my question. I've asked it multiple times. Is premiums here including the Part B premium that Medicare folks pay? because the task force calculated, or Optimus calculated, that's $1 billion. And the task force decided folks would have to pay that premium. And not everybody does. There's lower income people who don't pay that premium. And remember, we discussed earlier, some of them do get subsidies. And so anyway, I'm also confused about that premium and what are the machinations behind that premium number, and how does that work? And did it start with and include Part B Medicare premiums? I very much actually was trying to do what Richard has talked about, which I think we should be able to, again, start with a personal premium number that's equal to what people are paying now. That was it $4 or $5 billion, Richard? And then so that we can say you're already paying this. Now you'll just be paying it as a tax.
Mm-hmm.
So we're left with the personal income tax, which didn't seem to me to have much going on behind it, because when I would put these really big numbers, they pretty much translated over to the summary page. And I know that that's totally daunting. But I have my own sense of really wealthy people, and the pros and cons of them paying a lot of taxes. In a lighthearted moment, I thought, well, why don't we organize something where those 30,000 people who pay $100,000 a year in taxes, every one of them gets their name on a hospital in their region for like 30 days. I'll be notified. It's the old hospital that you designated, Good Samaritan, will be named the John and Ann Santa Hospital during the month of December, given your name. And thank you. Anyway, we can come back to that. This discussion that we've had has been very informative. I agree with Charlie about this double taxation. I kind of thought that, Charlie or somebody decided the most that could be deducted was 71%. So I just left it at that. But now I'm seeing that, you could deduct more. I must tell you, though, listening to the discussion, perhaps we need to have an accomplished tax lawyer as the next member of this committee, because and to look at both federal, are the feds going to allow an employer tax to be deducted by an employee? Wow, now that is policy. And if I understand that correctly, I mean, it's a roundabout way to get federal funds actually to pay for some of this, because Oregonians would be getting that a deduction, or I'm sorry, tax credit. It's even better, it'd be a tax credit. So that is a huge issue, and let's get going with figuring out whether that's doable or not. Finally, I'll end with just an aside. I started with a modest amount for the lodging tax, and then thought, oh, what the hell? I put it all the way up at the maximum. I think this is an interesting, if you will, side game that the universal health plan could do in a state. I think you could actually sit down with the lodging industry and say, this will be good for you. You get driven crazy by people who get sick when they're staying at your place. And believe me, they do. And I've been on the other end of having to take care of of travelers or taking care of patients of mine who are in Hawaii or stuff like that. Wouldn't it be great that the lodging industry could tell people from out of state, who presumably would be the only ones paying this tax, that, you know, if you do have any health problems, here's how to get a hold of health providers in our area. You will be treated just as well as any Oregonian, and they would get treated and taken care of without, getting their wallet biopsied in terms of their insurance. So that would come by the business that runs this. But I wouldn't waste any more time on that, because it doesn't make that much difference. That's how I came up with my numbers. I feel, I think kind of like Jeff, I learned a lot by playing the game, and I'm interested to know more. And some of that has to do with understanding these things that are going on in the background. That's it for me.
Questions or answers? I think Charlie may have an answer to one of the questions, but go ahead, Charlie.
So I do have an answer to one of the questions, and that's the Medicare premiums, Part B premiums. So this spreadsheet essentially does nothing with those. It is in essence, it's assuming that people will continue to pay their Medicare premiums as they do now, and that the state Medicaid program or a state single payer would continue to pay the Part B premiums for those who are eligible for Medicaid, which in essence means that it is assuming that the eligibility determinations will still need to be done. And I would expect that will also need to be done just to get federal funds. I can't imagine, well, I can imagine some ways around that, but that's my expectation, is that we would still have to do that. So it essentially assumes nothing about Medicare premiums in this spreadsheet. So these premiums are completely something else.
Yeah, my response would be that helps, but it bothers me that, well, wait a minute. On behalf of Medicare patients, why are we the only ones that are still paying a premium? In fact, to even get into it, we're going to have to pay that premium. Why didn't we get some credit for that? And it gives me an opportunity. Hold on, Charlie. It gives me an opportunity to emphasize. I'm 99.99% certain that Medicare folks will say, we want a calculator for us, because we're not sure we want to be paying for commercial for the people who are employed. And you know, we want to see how this pencils out for us. I think a lot of Medicare folks, including wealthy Medicare folks, may be less concerned if they understand how much of those taxes are going to their people, people 65 and over. And I suspect that most of it will be going to their people. And I think commercial people will want to know how much of this is going to Medicare folks. They've had it good all along. Why are, you know, they really need, they're the wealthiest, you know, they're the wealthiest age group. People 65 and over are the wealthiest age group in the United States. It makes sense that they are. So I really think we need to do some thinking about how to allocate how much are Medicare folks paying to support Medicaid folks, how much are they paying to support commercial folks, and vice versa. And then my final comment would be, there is a reason why people under 65 should contribute to Medicare, and it's the same reason that all of us contributed to Medicare when we were under 65, those of us who are over 65. And I've made this comment before, and I really think we have to have an Oregon Medicare trust fund that people pay just like they pay a payroll tax for Medicare. And maybe that focused on this will fund the difference between federal Medicare and Oregon Medicare. And you're putting money in that trust fund now, and we promise you it will be there when you turn 65. Anyway, thanks, Charlie, for that opener. Go ahead, Cheryl.
Sure.
I just heard a couple of things that I wanted to raise up again. And one is it didn't seem from any of you who presented your proposals that sales tax is really a viable option. And I wonder, to John's point, could we potentially sub that out for a sin tax option? I do know, having been involved in advocacy for increasing tax on particular beer, wine, tobacco, etc., that's a whole project in and of itself. So I'm not sure how viable that is, but I do wonder if we add that category and then take out sales if none of us thinks that's actually viable, as a possible next step. And then with lodging, to John's point, are we assuming this extra lodging tax would only be for out of Oregon visitors? Is that something we can do? Is that how this was computed?
Right now, it's just on
No.
all lodging expenditures, but I don't know. Administratively, it seems
It's
challenging.
hard. It seems like it would be hard.
No. If you go to a downtown hotel,
Oh, do they?
you're paying it.
Oh, yeah.
Oh, no,
but
just-
you don't pay only if you're out of state, though.
No, everybody pays it.
Everybody pays.
Yeah.
Everybody.
May I make just one point about Cheryl's real quick? I just wanted to point out that I feel like I should put in the calculators the sin taxes first, which again are only $500 million a year, and correct the base for the sales tax so that people can actually make real comparisons. I mean, I'm not making a suggestion vis-a-vis taking out sales tax, but just that it's fair so people know it.
Good. Yes.
And again, you can do both. What I was trying to suggest was I don't think sin taxes could compensate, for sales tax, but much smaller magnitude. And also, what we're looking at here is unfair to sales taxes. Basically, you would earn double the income, double the revenue at the same rate, more than double.
Okay. Go ahead, Charlie.
So a general comment is that in the scenarios, to me, the most important point is what parameters did they choose? What was the corporate income tax rate? What was the employer personal income tax rate? What was what were all the parameters that are variable that were chosen to raise these? And because that's how I would look at the comparisons. The second comment relates to what John was saying. So the only income that I think is going to have a special category and be treated differently is going to be Social Security income, because by the Oregon Constitution, we cannot tax that. And so to me, that would already say, okay, Medicare eligible people are in general already getting a benefit from the way the tax structure is set up and not having to pay taxes on some of their income. And so that, in my mind, justifies why they would be paying, can still pay federal taxes. If they don't continue to pay the federal Part B premiums, then the state would have to do that. And we would have to come up with enough money to pay that in addition, which is, as John said, is probably more than $1 billion a year. And so that would raise our revenue requirements. Another thing that I want to point out is I think we really do need to revisit the revenue requirements, because if indeed the revenue requirements are what we're talking about, I don't think we're going to get there. I think that we need to seriously consider assuming or proposing that we do not give providers such a big advantage for all the administrative savings that they're going to get and let them pocket that money, that we actually decrease the amount we pay providers at least closer to the place of what their administrative administrative savings should be if they do a good job of it. So I'll stop there.
Okay, Jeff.
May I get one more clarifying point too? I should have made this earlier, perhaps. I'm a little confused about why people were targeting 22.5. I think that is the funding gap that was projected for 26. I think in 22 it was 18.5. Is that right, Charlie?
It's more than that. There was a range. I think it was.
Yeah, well,
it was. Yeah, and it was. I think that 20 billion was the top end of that range. So I think 22.5 is higher than it needed to be.
I think it's the 26 number. Do you understand the point I'm making? Maybe Richard.
I think the document that was, in the spreadsheet. I mean, I took 22.5 because I just assumed it was worst case.
Okay.
And that was the 22.5.
That's fair, particularly in light of in light of the apparently growing gap. Yeah, but yeah. Well, I think technically the optimist thing plus the 2 billion assumption that Charlie put back in there landed us at 18.5 for 2022 for what it's worth.
Okay, Jeff.
Thank you. On a couple of thoughts. Number one, to Cheryl's question about the being able to identify the lodging tax from out-of-state people, just going to out-of-state people if they need something. The administrative costs on that would be enormous.
Yeah.
And secondly, then what would happen if those dollars get used up that have come in from the lodging tax? So don't think it could administratively. I don't think it's possible to make it work. And then, yes, I agree with the comment that the material we got, again, thank you, Charlie, had several different scenarios, and 22.5, I think, was at the higher end of the scenario cost.
Okay. Cheryl.
It seems to me that we're not going to be ready to decide on a straw proposal for the board, which would have to be done today in order to make it for the next board meeting anyway. So there's no way in the next few minutes. And we have some things to do that we've been talking about in terms of the user guide and some other things that you all have mentioned. So I'm wondering, first of all, if we can just try to get ready to have this to get all this done, and then to discuss to discuss where we're landing at the next meeting so that we can have a straw proposal for the September board meeting. So I'm just kind of looking forward as to what's reasonable, and I would look to Echo Northwest too on how long this will take you to do all of this work, and how long you would need. In addition to, I'm sure Charlie will be involved, maybe others, to get this part done, kind of the back end work, and then we reevaluate, and we have time to really sit with it, and then come to the September committee meeting being ready, to decide. So I'm just seeing what's possible, what's realistic. Yeah.
I'm actually really curious for folks' feedback on where they want to go, but I think it's a very great positive conversation. You guys actually covered a lot of ground. I might just jot it down. You really kind of mapped out 3 broad options here that you can actually kind of call them firm up in some scenarios to help engage sort of additional learning and discussion. And I think that's something we could tee up within the model and within some writing so people can kind of understand why is this constructive, what's the relationship of these pieces. But I'm kind of curious for other people's thoughts on that question as well. But we'll go Mary Lou, Charlie, and then John.
Okay, my quick question was it John or somebody was saying that we're going to have to do eligibility determination for everyone? And okay, Charlie, and so it's like, I'm not sure exactly what that means. I think that the other committee is looking at eligibility, I'm just not wanting to see that we have some kind of financial eligibility screening for everyone that is an administrative overhead cost at the state level, but that people who want to claim they have some kind of special whatever it is, whether it's either that they're on the really low income and they want the plus benefits, or it's somebody who's on Medicare that wants something different or whatever, but just this blanket statement of eligibility for everyone just kind of chills me.
Charlie, do you want to answer that question from Mary Lou?
Well, I'll answer that in another comment, or I'll sort of answer it. So in my mind, we're going to have some way to help the federal government decide how much money they're going to give us. And the reason for giving us money is primarily because we have people who are eligible for Medicaid and we have people that are eligible for Medicare. And it would be nice if we could just say, oh, just give us some prorated amount based upon when we go away from this, based upon how much Medicare and Medicaid are increasing everywhere else. And that would be wonderful if we could do that. My guess is we cannot get away with that. So we'll have to say, yes, we indeed have this many people who are eligible for Medicaid, and therefore you need to pay us this much money from the federal government. I'm guessing we might have to do that. Another one is same for Medicare. I'm guessing that we will have to say we have this many people who will be eligible for Medicare based upon age, this many people who are eligible for Medicare based on disability, and therefore you need to give us this much money. Maybe we can get out some other way around that, but I don't think that's going to be very likely.
Okay.
Again, it would be nice if we did. My other comment is I still think we need to go back to the questions. What's the nature of the tax system? And to me, the biggest questions are, there's two really big questions I have that we kind of talked about. We haven't really come back to a particular one. One is, should all of the payroll tax be creditable on the personal income tax, or should the smaller amount be creditable? And then the other question is, in general, should there be a soft cap on personal income tax, or should there not be a soft cap, any cap at all? I mean, it just go up by rate somehow. And I guess I should say there's a third question. Are personal premiums something we want to include? So those are the nature of the tax structure things that I think we really need to somewhere land on something in order to go further in getting more details. Before those things are critical for what the particular rates are going to be to raise a certain amount of money. So let's stop there.
Go ahead, John, and then Mary Lou.
Yeah, two things. The task force assumed, and I would urge that this assumption be true for the Universal Health Plan Governing Board. Medicare is going to determine eligibility for Medicare. We don't want to repeat the federal process.
Right.
And then I think there's not a snowball's chance in hell that they would let Oregon determine who's eligible for Medicare. They're going to tell us who's eligible for Medicare.
Mm-hmm.
Then the tricky thing is, well, what about those Part B premiums? Because again, we don't want to mess with their cash flow, and because they're collecting them, mostly from Social Security. Most of us tell Social Security, pay my premiums. Oh my gosh, don't disrupt that. But that means we will need to know, hey, wait, who hasn't done this? Because whoever hasn't done it, we are going to need to deal with them. It does bring up an issue that I think the board's going to have to deal with, which is, can we cover Medicare age folks who are not citizens? That's going to be a very tricky process, especially with the Trump cutbacks. Medicare patients are 3 times as expensive as people under 65. I don't know if that will hold true for residents. And nobody wants to cover all residents more than I do, but that's going to be a tricky issue. The second thing I wanted to make comments about is the board meeting. I think it would be good for the board to get a report on how much progress we have made. Mm-hmm. Because I think we are making terrific progress. I think that they should be teed up, realize there's some very interesting policy issues. We're making the assumption that we could call this an employer tax, but that would create a tax credit for the employee. And we got a lot of work to do to figure out whether that's doable. We're making an assumption that we could collect premiums and call those those really would be collected like a tax.
Yes.
And that would be equal to the amount that the $5 billion that folks are paying now. We have, I think, made some important assumptions. I wouldn't want to say decisions today. And finally, I think they should get a bit of a primer on the calculator. Because again, I just go back to this is the way it should be. And that board members should be able to say, hey, I got familiar with the calculator and looked at all of these options, and I understand what's going on. So Cheryl, I think there is something substantive to report and do, but it isn't at the stage of a final recommendation from us, but they better get prepared.
Yeah, totally. Just breaking in here. So we always do a committee report for the board meeting, and I'm happy to do that with Echo Northwest's help. I thought I heard Mimi say that Echo Northwest is going to present anyway, so they could give a substantial update on where we're at. And so yeah, I agree totally. Not to just wait until we actually have our straw proposal. There's a lot here that we can update them on. I think that's not a bad idea to show them the calculator and let them try it out. So yeah, I totally agree with you. I know we have a couple more comments, but I also want to make sure we get our public comment in before the meeting ends. I also want to make sure I know how long it will take Echo Northwest and probably some of you to do the additional work on the calculator and to prepare us for submitting a straw proposal. So I want to know from Echo Northwest in particular, do you need the time, let's say, a couple of weeks or so to get this done, and then you send it back to us, and then we have some time to either submit our proposals to the group or to redo our proposals for the September meeting? Or would you prefer would you prefer that second meeting in August? I guess that's what I'm trying to get to.
Yeah, so I think to me there's two ways to do this. If we want to pick up the discussion next, I think in 2 weeks, right, is the time we're holding. What I would recommend then is for us to take a crack at some counterfactuals, to do a little presentation. I think just to kind of what I think a quick summary here is, I think you really have a core proposal, right? That core proposal is some corporate income tax, payroll tax, and a personal income tax, right? Those are the core pieces. Within that, Charlie has flagged what I think are the 4 central questions that we need to understand some counterfactual analysis, right? Is basically what % of the credit of the employer payroll tax should flow to the personal income tax? Should there be a soft cap on the personal income tax to compensate for sort of total payment, particularly amongst high contributors? And then how do we want to treat the sort of what we're calling the personal premium, but basically the level of cost sharing and how that's operationalized. The fourth one is really a smaller piece, is really about the exemption status for small employers, where you want that to kick in, but it can make a difference. So one way to think about this is for us to take that core proposal and to run with some different counterfactuals. So you can see the relative trade-offs of setting those policies either higher or lower at other end to help sort of stimulate the conversation. So that would be kind of like, let's meet quicker, but we're doing some work, kicking out some slides for you to consume and playing with the model so you can kind of see, okay, here's this counterfactual. You can play with it if you want. We can also potentially do some what I'll call options 2 and 3, which are really about, should you include the sales tax? should you include lodging and or sin taxes, right? Or really kind of the sort of other complementary taxes outside of your core piece, right? And the idea there, right, is really you're just expanding the tax base so that your incidence is less in terms of your revenue generation amongst your core proposal. So that would be kind of the short turnaround piece, like us do some work, kick it out, have the conversation again in 2 weeks. A longer piece would just for us to be kind of like, well, let's rebuild the thing, the model, kick it back out to you, and do a similar exercise in September. So that's to me how I think that I would benchmark it, Cheryl. Which of these do people feel like would be more beneficial in keeping this conversation going?
2 weeks.
Well, okay, personally, I prefer the second option, but I'll leave it up to the group.
Richard, I'm assuming the 2 is not option 2, but 2 weeks.
No, option.
Okay, Richard gave me a hand sign there. But Charlie, Jeff.
Morgan, are these mutually exclusive, right? I mean, we can do a 2-week.
Yeah, we can do mutually exclusive.
So relating to the eligibility determination, I think people misunderstood. I'm not saying that Oregon will determine the rules for eligibility. Obviously, the federal government has already determined that. That will still need to be done. There will still need to be, no matter whether we try to get a waiver or we try to get the Oregon to be a Medicare Advantage provider, there still need to be a determination of, is this person eligible for Medicare, in order to figure out how much money the federal government should send us. And a second, and it's much more complicated for Medicaid. I mean, Medicare is pretty easy, but for Medicaid, the state indeed pays for software and a system to decide, are you Medicaid eligible? And this is especially true for those trying to get Medicaid compensation for long-term care. So I don't think that we are going to be able to say, no, we're just going to get some amount from the federal government. We're going to still need to put something in there to the federal government and say, this is how much we need to get because of these reasons. I can't imagine we're going to be able to get around that. But it'd be nice if we could. As far as can we do the credit of the employer payroll tax on the personal income? Yes, of course we can. That's a choice of Oregon tax law. The question is instead, if we do that, is the amount that the employer pay exempt from corporate income tax? So that's the question. It's not that can we do it? Yeah, we can do that. Is it exempt from federal income tax? So it's an income tax question.
Okay. And Charlie, do you have a preference?
Charlie, hold on a minute.
Hold on, Jen. Just let me finish with Charlie. Do you have a preference on sort of the 2-week turnaround or versus month turnaround?
I would prefer 2 weeks, but just in order so we can talk to each other some more.
Yes.
But yeah.
Perfect.
So Charlie, are you saying this would only be a state tax credit, not a federal tax credit?
Oh, absolutely. Yes. Yeah, absolutely. This is for our tax structure. It's a credit on our taxes.
Okay.
Yeah. So yeah, Oregon personal income tax.
Yes.
The issue
Yes, exactly.
is whether
Yes.
or not from a when C corps file their corporate income taxes, do they get to count the fact that they paid this tax as a deduction against their income?
Yes.
Okay.
Yeah.
Jeff.
2 weeks.
All right. Thank you, Mary. Jeff.
2 weeks for the board and committee updates. I think it's important to get 3 points to the board and to the other 3 committees. Number 1, that we are looking at PEB Plus in terms of the coverage. Number 2, we are looking at for $20 billion in additional taxes. And number 3, as to the point made earlier, here are the 3 primary sources, although there may be more. I think it's important to get those points to the board and to the other committees.
Yep. Thanks, Jeff. Great. I'll turn it back to you, Cheryl. I think.
Yeah, we need to let the person who has signed up for public comment do public comment. It's getting kind of late. So is that person here?
Yes, they are. Tom would like to give public comment today. Just to give my general spiel. Written public comment can be submitted at any time via our website, and we ask that people submit that 72 hours in advance of a meeting. For oral public comment in the meeting, we ask that people sign up 24 hours in advance. Public comments are limited to 2 minutes, and We may ask you to wrap up if your comment exceeds that time. And if you have anything additional to share, you can sign up for a future meeting or share that in a written format via our website. But with that, I will give the floor to Tom.
Thank you very much. Boy, a lot to unpack. This is a very robust meeting. Great information. My name is Tom Sinsick with Nurses for Single Payer. We ought to get to a single payer system. I'm going to try. It's all highlights. It's hard to give public comment before you hear what you all said. So there'll be something extensive in writing coming after this. I want to highlight some things. Thank you for continuing to talk about references to administrative burdens and administrative cost. They have to constantly be reflected. What I didn't hear today, though, was what you're achieving is access to care that people need when they need it. So when Cheryl talks about a $10,000 deductible, people are not getting the care they need when they need it. So continuing to reflect back on those main access goals will be helpful as you think about paying money out and where it's all being collected. I want to say that for myself, I said, tax me at 25%. Right now, we're paying 3 places through PERS. I got money taken out. We pay dental and somewhere different, and we get Plan B Medicare, right? So 3 different places. So tax me up, right? So I've looked at this, right? Happy to pay it and stop having to think about it. Right now, we live in a worry-free zone based on what happened and a recent $18,000 bill for a hospitalization for my spouse, which we didn't have to pay. So an assumption that's always made is about small businesses. There's a lot of small businesses that have wanted to pay. They couldn't pay based on the complications and the administrative burden based on the thing. So stop making assumptions about small businesses who do not pay anything right now. That means they won't pay anything ever. I think that's an important thing to make. I'm glad you're straightening out this word premiums should go away and everything else because of this time limit, which I think should be more than 2 minutes. It will be in writing. Thank you for your time.
Thanks so much, Tom. I really look forward to seeing your testimony in writing too. I just want to say really quickly, and then John, if you have a quick point, I'll hand it over to you. Looks like I was outvoted, so we'll have the second meeting in August. We'll send out an agenda and all of that soon, and whatever Echo Northwest has for us that we can look at for that second meeting. John, did you have something?
Well, I believe the board meeting is also on August 19th.
Yes,
from
it
10 to
is.
12. So at least 2 of our members wouldn't be able to be in 2 places at one time. So just want to make sure people know there's
there's one.
No.
Our committee meeting is on a Tuesday and the board meeting is on a Thursday.
Correct.
I will be at the board meeting. I will not be able to be at this committee meeting, so I'll talk to Mimi about that. So, yeah.
So
okay.
It's the 21st.
Oh, yeah, the 21st. Yes, it's
And
Thursday.
this one would be on the 19th, correct?
Yes.
Okay.
It's already on the calendar.
Yep.
At least mine. Yeah.
Okay.
Okay. So with that, we'll adjourn. Thank you for the really great meeting. Learned a lot. Appreciate Echo Northwest for all your work and all the committee members as well. Have a good rest of the week, and we'll see you next.
Thank you.
Bye.
Thank you.
Thanks, everyone.